We really needed a new way to offer services, to design services for young people, and that was kind of the origins of the project.
A new project aimed at redesigning youth mental health services in Canada has significantly cut waiting times and helped connect more young people to care. That's what data is showing from Access Open Minds, led by McGill University researchers in Montreal.
In Canada and in multiple countries across the world, there is a clear pattern. So even before the pandemic, there is a clear pattern of increasing mental health problems and concerns among young people.
Lead author Srividya Iyer, professor in McGill's Department of Psychiatry, says a barrier for most youth is access to care. This project removes barriers like needing a professional referral, which often discourages youth to seek help. At their downtown Montreal site for homeless youth, they saw a dramatic increase in the number of young people accessing services.
People who typically are the ones who are left out of systems, so Indigenous young people, not just in Indigenous communities, but also in urban centers, young people who are ethnic minority, immigrant, those who are homeless, LGBTQ young people. These were the people who actually access services in higher proportions than their proportion in the population.
Iyer says 70% of mental health problems start between the ages of 12 to 25. The project also addresses gaps in access for Indigenous, remote, and underserved communities. Of the 16 communities served across Canada, 5 were in Quebec. Over 4 years, nearly 8,000 youth ages 11 to 25 were referred across 11 study sites.
It's really important that services reflect people's cultures, communities, and languages. Otherwise, they really don't see themselves in it, and then they don't show up, and then we wonder why.
Youth report trends in society as factors from housing, groceries, intergenerational traumas, and climate change. A main goal, Iyer says, is to make this project sustainable for all, along with early identification and outreach. If you or someone you know is struggling with mental health, information is available online at accessopenminds.ca.
We also need upstream policy responses to make sure that young people have societies that really care about them and their well-being. We need to make sure that if they are worried about climate change, we have sustainable housing options, employment options, that we're really thinking a lot more holistically about what is it that we need to do if we're really serious about supporting young people.
In Montreal, Tehosterihens Deer, City News.